everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head Neck Surgery. And today I have with me one of my former stellar medical students who is now, I can't believe this, completing her second year of otolaryngology training at UC San Diego. Welcome, Morgan Davis.
Hi, everyone. Thank you for having me, Dr. Jefferson.
So happy you could join me and answer some questions for our aspiring otolaryngology residents.
Of course.
I want to talk to you a little bit about how to maximize your fourth year away rotations, because obviously you can't rotate everywhere that you're interested in potentially training. So how do you prioritize the programs that you apply for an away rotation?
So I guess what I did and what I would recommend doing is trying to make a list with a bunch of different categories. For instance, first and foremost, I would think about location. Think about if you have any outstanding circumstances where you need to be tied down to one region, or whether you have a significant other that's going to be in one region, or whether your couple's matching. All of these things are definitely important to consider when you're thinking about programs that you're going to go and visit. And I would put all those programs in one category, and then make a separate category where you don't really take location into consideration, but you can just, list all of your ideal top programs that you would love to be a part of. And then I would also try to make smaller subcategories where you think about institutions that may be larger institutions that have lots of fellows, institutions that are a little bit smaller, don't have as many fellowships within the program. Think about programs that maybe are very high volume in head and neck cancer, and programs that have less head and neck cancer focus, but maybe focus more on otolaryngology, or very busy acoustic neuroma centers, things like that. And then once you've kind of made a list with different programs that fit in each of these different categories, then I would try to narrow it down from there. I think that it's really important to try to get a variety of programs. That way you can try to see what you like and what you don't like. For instance, if you're at a smaller program, go and visit a bigger program so that you have something to compare it to, that you know how that works. You can compare it to what the larger program is like and how that runs, and see if that's something that you think would be a good fit for you. Whenever you are doing these away rotations, not only are the programs interviewing you essentially for a month-long rotation, but it's also an interview where you're interviewing the program. It's like you are searching for a brand new house, and you're going off on a housewarming tour and open house, and that's your one time to be able to really see firsthand what the program is like and get that experience.
Excellent advice. So now, once you are on your acting internship away rotation, how did you effectively integrate yourself into the team without being obnoxiously obtrusive to the workplace environment with all the residents and faculty?
Yeah, I think a good rule of thumb is at the very beginning of the rotation, reach out to either the intern that's on service, or whichever resident you feel like you're going to be working very closely with. Reach out to them and just ask them, like, hey, what are your expectations? What does your day typically look like, and what can I do to help you and make your work more efficient? And then once you've gotten some of that advice, you can kind of go from there. So I would definitely recommend trying to get to the hospital, at the same time that the intern is getting there, or getting there even a little bit earlier, so that you can help prepare the list and chart check patients and look and see if any special events happened overnight. If there was some outstanding event that happened overnight, make it a point to go and speak with the nurse that was on overnight and get firsthand information and ask the nurse, what happened. So that way, when you're going around rounding on patients, you can actually add to the conversation and add to the plan. And you have information and updates that is beneficial to the team, because the other residents may or may not have time to be able to go and talk with each nurse, before they see patients in the morning. I think that's very helpful. The other thing that's very important to do is make sure that you're always prepared when it comes to supplies. So I had this, basically it was like my supply bag essentially. And, every couple of days, I would make sure that I would go to the supply room in the hospital and kind of refill things. You want to just have common supplies that the residents will need, and they'll look to you. And if you have it, then obviously that's very, very helpful, and you're effectively contributing to the team. So you want to always have tongue depressors. If you have an otoscope, that's great. You want to always have a suture removal kit, a pair of scissors, extra gauze, extra tape, things like that just will save time, and it'll make rounding so much more effective when you're checking on a post-op patient and you're taking down the dressing and you already have all the supplies that are right there that you need for the residents and yourself to help redress afterwards.
Excellent advice. And how did you prepare for the day-to-day activities, so that you obviously demonstrated your knowledge base? You weren't obviously interjecting information, but without being called upon. But how did you make sure that you were prepared with the knowledge needed for day-to-day activities?
So I always had my handy dandy Netter's anatomy book, and it's really important to just refresh, and know your anatomy. As a medical student, you're not going to be expected, well, I don't think you'll be expected in most cases to know every single step of the surgery, but anatomy is something that you should definitely be familiar with. And then you should also at least read up on the surgery and know some basic details, know why you're doing the surgery, read up on the patient, make sure that you've read the note that the attending wrote when they saw the patient in clinic, and you know what the indications for the surgery are. You know how the patient was worked up, and to get to the diagnosis where they are. And if it was like a biopsy or something, you know what their biopsy showed. And you should just be familiar with all these minor details so that you're not just walking into a surgery but not knowing why you're doing the surgery or knowing pertinent information about the patient. And I think that will really show and really stand out. And then whenever you're reading about the procedure or the surgery that you're doing, kind of start to think about, higher level questions that you may have, that you may want to ask the residents or the attendings. Obviously you don't want to ask the attending a dumb question, because then it looks like you haven't read. But if you've actually read about the surgery and you looked up things and you ask kind of like a next step question, then I feel like that shows that, you're very interested, you're very engaged, and you truly want to know the information.
I would agree with that. Any final advice you want to share?
In terms of rotations, or
in terms of rotation?
In terms of rotations, I would say this might come off weird, but you want to be the first person there at the hospital at the beginning of the day, and you want to make sure that you don't leave before all the work is complete. Doing a sub-internship is not necessarily the easiest month of your life, but it's a 1-month tryout, a 1-month opportunity to show off everything that you've learned and everything that you've accomplished up until this point. And so you want to show that you have a great work ethic. You want to show that you have a great attitude. You want to show that you're always willing to help. And whenever you're the intern, you are going to be the first person at the hospital, and you're probably going to be the last person on the team at the hospital. So go ahead and show them that that's what you're made of, and that that's what, you're basically already at that level to where they could see that you would be an awesome intern, and that program would want you to be a part of their program.
Perfect advice. Thank you for sharing. And if you find my tips helpful, share them with your friends. Continue to follow me at Dr. Gina Joe on Twitter, IG, and YouTube.